Maria von Kerkhove, our technical lead for COVID-19. We have also Dr. Bente Nicholson, Director of Non-Communicable Diseases. Joining us online will be
worldwide. We have more than 30 candidates now in clinical trials. About 9 of them are in phase 3 clinical trials. There are at least 3 clinical trials going on in India, phase 1 and 2 trials. So it's a very optimistic scenario because there's a huge field of candidates. And we know that normally in vaccine development, we expect about 10% success rate. And so to have more in the early stages of testing gives us hope that several of them would be able to be, prove themselves to be safe and efficacious. But as we said earlier, these need to go through the full phase 3 clinical trials before we can answer that question. We expect results from some of the candidates which are already in phase 3 trials to come by the end of the year or the beginning of next year, following which there will have to be scaling of manufacturing to produce the hundreds of millions of doses that are going to be needed. In fact, the world is going to need billions of doses, and that's going to take time to manufacture. So we have to be optimistic and realistic at the same time. So realistically speaking, probably the second half, the middle of 2021, maybe the second quarter, third quarter of 2021 is when we can start seeing doses actually flowing into countries so that they can start immunizing their populations. And as Bruce was saying earlier, we're not going to have enough for the whole world right at the beginning. We're going to see first tens of millions of doses, then hundreds of millions of doses, and subsequently, hopefully, that scale up will happen. So eventually there will be enough for everyone, but it will mean prioritization of groups within countries who should receive those first tranches of vaccines. And this is where the COVAX facility and the fair allocation framework that's been developed by WHO in consultation and agreement with our member states would play an important role in determining how those scarce doses of vaccines in the beginning will be distributed and used, hopefully in a fair and equitable manner, so that, as the DG was saying earlier, it is important to make sure that the people who need the vaccines get it, regardless of which countries they're living in. There's no point some countries vaccinating entire populations while others are waiting for a long time. So that's what the COVAX initiative and the COVAX facility aims to achieve. And if it comes sooner, the better. But certainly by the middle of 2021, we should start seeing some vaccines actually moving into countries and into populations. Maybe Bruce wants to add.
Thanks. If I just may